everyone, I am Erica Navarro from 11D Group 15. In today's video, I am going to perform a return demonstration on how to administer parenteral administration medication. So why we need to practice parenteral administration medication? It is because we have a client or patients that has different types of illnesses and diagnosis. So in performing parenteral administration, we have three types. The first is the intradermal, which is below the epidermis. Next is the subcutaneous, which is injected directly to the fats of our clients. Lastly is the intramuscular or injected directly into the muscles of our client. So example in parenteral administration, the patient who has a diabetes. So patient who has a diabetes is injected with insulin. So prior to that, client with diabetes, nurses will perform a subcutaneous administration because insulin is injected directly into the fats of the client who has a diabetes. So that is one of the example. So before we proceed in the return demonstration, I am going to show you the equipment that I am needing during the assessment. First is the working gloves, clean working gloves. Next is the medicine tray, the gauze, and the alcohol swab. Next is the 1 ml or 1 cc. This will be used during in performing the intradermal and subcutaneous. Next is the 3 ml. This will be used during in performing the intramuscular injection or injecting the intramuscular. So without further ado, let's get started with the intradermal followed by with the subcutaneous and intramuscular. Intradermal administration medication. Prior to start the intradermal administration, we need to check the doctor's order to know what is the medication that is appropriate to the client. And next is introduce yourself to the client and verify the client's name. And explain the procedure so that the client will know how to participate during the assessment. Next is wash our hands. This is to avoid the cross-microorganism, and arrange the medication card in the hypodermic tray with the corresponding drug. Good morning, sir. Ako day si Erica Navarro. Sir, ako ang imuhang student nurse for today, sir. Pwede mabalan imong name, sir?
AJ Navarro.
Okay, kamusta man ka today, sir?
Okay lang.
Okay lang. So, ang akong buhaton karon, sir, is mag-injection ko sa imong forearm, which is indication if naaba kay allergies or any other diagnostic purposes po. Okay lang po ba?
Okay lang.
Okay po, sir. Mag-start na po tayo.
Okay.
Choose an injection site that free from lesions, tenderness, masses, or any other skin problems. For example, for that is edema. Then position the client's arm so that his elbow and forearm are supported in the flat surface. So, sir, okay lang, sir, i-check na kayo mong arm.
Okay.
Palpate lang na ako, sir, ha? During palpation ako, sir, na kayo ma-feel ng mga sakit-sakit?
Wala man.
The other side po. Okay, sir, okay lang i-position ako mong arms dire. So now we will apply our clean gloves. And after applying a clean gloves, we will now use the antiseptic or alcohol swab to disinfect the site where we will inject the medication. And doing in an alcohol swab is, in disinfecting, we will do it in a circular motion or circular outward motion in about 2 inches to 5 centimeters. Relax lang, sir, ha?
Okay.
After applying a antiseptic, let it dry, but remember that do not blow, just let it air dry. Now we will get our syringe and remove the cap. Hold the syringe with your forefinger and your thumb with your dominant hand. After holding with your non-dominant hand, use your forefinger and your thumb to stretch the skin down at the injection site. Now, pull the needle closer to the patient's skin at the 5 to 15 degree angle. If you feel resistance, advance the needle up until into the epidermis at 1 to 8 inches. After that, release the medication or inject the medication. If you see a resemble of mosquito bite at the patient's skin, withdraw the needle at the same angle. And pat a dry cotton ball. And remember, do not massage where the site you injected the medication because it might damage the tissue. Encircle the wheel with blue or black pen and instruct the client to do not rub, massage, or scratch or any other things that might he feel discomfort about the medication that injected earlier. So sir, kailan lang na ako na adiri akong genjikan sir ha?
Okay.
Ang remind lang sir, ayaw jud siya kanang magkalot gani ka, ayaw gani dutag maayo. Ayaw po
Okay.
kung magkalot ka kanang kung pwede matiis nang nimo siya. Tapos ayaw po ipa-massage. Basta nag-outline ko dira dapit ang nag-inject ka ganina.
Okay.
Okay lang sir?
Okay.
Assist the client in a comfortable position and indicate the time where you injected the medication. And also, do not recap the used needle and discard the syringe, the cotton ball, and the alcohol swab in the appropriate receptacle and document all the findings or document all the procedure that we did earlier. Balik na nato sir ha, na comfortable na ka. Ay basta ayaw lang yun siya kanang i-rub or any other itong giingon nako kaganina.
Okay.
Tapos oras na ko siya na-injikan kaganina is mga 9:10.
Okay.
Okay sir, thank you.
Salamat.
So in subcutaneous administration medication, prior to start the procedure, we will perform the 4 steps that we did earlier. First is to check the doctor's order. This is to know or this is to ensure the specific medication to give to the client. And next is introduce yourself to the client and verify the client's name and explain the procedure so that the client will know how to participate during the assessment. And next is to wash our hands. This is to avoid the cross microorganism and arrange the equipment with the medication card at the hypodermic tray with the corresponding drug. And this time, explain the purpose of the medication and explain the adverse side effect of the medication. So, good morning, sir. Ako day si Erica Lea Navarro. Ako ay imong student nurse for today, sir. Kamusta man ka, sir?
Okay lang.
Pwede mabalan imong pangalan, sir?
Lygie Navarro.
Okay, sir. So, sa karon, sir, maghatag kog injection sa imuha, which is ang insulin. So, ang insulin, sir, is nag-help sa imuha mag-regulate imuhang blood sugar. And naano siya yung mga adverse side effects, sir, which is mga common kay hypoglycemia, naapoy o headache. Sir, so naa ba kay mga any other questions, sir, or concerns?
Wala na.
Wala na. So, mag-start ka ta, sir.
Okay.
Determine the site which you will use and then expose the skin that it is potential for the injection. Next is examine at the area where you will inject the medication if it is free from lesions, tenderness, redness, bulges, or masses, or any other skin complications. And after that, grasp a skin fold of the client. This is to ensure or measure that the needle is about half long. Place the patient in a comfortable position and ask the patient to relax sa the area where you could inject the medication. So, sir, pwede mo na kamabalan kung asa ang last nag-i-injectan ka?
Hindi
Diri ah. Sige, so, okay lang, sir. I-open ako, sir, ha? Diri lang man, sir.
Okay.
Okay lang, sir. I-palpate na ako.
Okay lang.
Wala kayo ma-feel na pain, sir, during na palpation?
Wala man.
I-pinch na ako, sir, ha? Kadali lang.
Okay.
Sige, sir. Relax lang. Sir, dili ko mag-inject, sir. I-relax lang imong lawas, sir, ha? Para dili ka ma-tense if inig niya pag-inject.
Okay.
So now we will apply our clean gloves, and after that, using our alcohol swab, we will disinfect the area where we will inject the medication. In doing the disinfection, we will do it in a circular motion from inward to outward. Relax lang, sir, ha?
Okay.
After disinfecting the area, we will let it dry, but we will not blow it. We just let it air dry. So now we will get our syringe. We will remove our cap of the syringe and put it on a medicine tray, and using our forefinger and thumb, we will hold our syringe. It's just like we are holding or playing a dart. And insert it quickly at 45 to 90 degree angle at the patient. So, sir, relax lang, sir, ha?
Okay.
And then release the pinch. Then after releasing the pinch, I will place my non-dominant hand at the patient and move my dominant hand at the edge of the plunger and slowly release the medication to the client at several seconds. After injecting, withdraw the needle and place it with swab or cotton ball, and make sure that it is not massage because it may damage the tissue. Now, place the patient in a comfortable position and document all the procedure. Close na ako, sir, ha?
Okay.
If na akay mga concerns, sir, ayaw ka hesitate mag-ask of question.
Okay.
Sir, thank you!
Salamat po.